Today we'll continue our set of lectures about environmental and nutritional diseases, and in previous class we stopped on alcohol intake, and then we discussed all the pathology of alcohol abuse. But now we'll discuss, and also we'll discuss about therapeutic drugs abuse. Therapeutic drug side effects of therapeutic drugs. But now we'll discuss the injury of which is made by non-therapeutic agents. They're known as drug abuse. We a little bit discussed about this point about what is which kinds of ethical properties we have. So why don't we ban alcohol? In most of countries it's not banned yet because it gives some little we have no, actually, we don't have to ban this alcohol in countries which have no religious aspect of this. We have to reduce it, we have to propagate it, so we have to explain for everyone how, if they want to get alcohol, so how they need to get it, but not without abuse of it. But in case of drugs, in case of non-therapeutic drugs, in case of drug abuse, it's in most of countries it's banned, and only few drugs are not banned. Only in a few countries, few drugs are not banned, but predominantly they are banned all over the world. And let's discuss them. But still we have abuse. Still we have a lot of junkies, drug users, which are present in every country. So even if it's banned. So let's talk about that. So we have classes. They are cocaine, opiates, marijuana. And we will briefly discuss about them. Okay, cocaine. Cocaine, it's first of all, how cocaine were used. So cocaine is produced from coca plant. It's present in Southern America, and it's firstly used by American Indians, so Southern America Indians, and they use it like leaves. They extract some components of it, and they use it for their meditation or some other religious events. But later, so when the Europeans came there, so of course they do everything like on industrial way, and they extract cocaine in large amounts, and then okay, what's the effect of cocaine? Cocaine produces a sense of intense euphoria and mental alertness, making it one of the most addictive of all drugs. But addiction of cocaine is only psychological, so physical dependence seem not to occur. So psychological dependence is profound. Actually, we use cocaine is used by inhalations. So intranasal inhalations. So it's a powder. And you inhale it with the nose, and then it's absorbed, and then through the blood-brain barrier, it penetrates the blood-brain barrier much faster during the inhalation of this from the nose. But also in USA, so now it's more popular, and much cheaper is crack. Crack cocaine. So this crack cocaine is not inhaled. So it's crack cocaine is inhaled with so it's smoked. It's smoked. So we have special device to do this. So they just heating this crack, and then it creates this sound like cracking, and that's why it's called as crack. And in inhalation of this provides the same effects because it inhales in lungs, and from lungs it goes directly to the general circulation, and that's how it enters into the brain. So it has a popping due to heating, so as shown here. So and cocaine is an activator of sympathetic nervous system. So that's what I need to say. So because if we talk about morphine, morphine is a more relaxive drug. So but cocaine is an activator drug, and that's why it makes cocaine very common in some parties, yeah, in some pleasant, so in some activities like I don't know, in some recreative drugs. So you mean I mean in cases of, yeah, in case of parties, of dancing parties, yes, where this is used usually. Okay. Experimental animals will press a lever more than 1,000 times and will forego food and drink to obtain the drug. In cocaine users, also physical dependency not occurs. The physiological dependency is profound. So actually, yeah, in animals, so experiments in animals. So what happens there? So in okay, let's okay, let's keep it. So, but a danger of usage of cocaine is first of all its cardiovascular effect. Cardiovascular effect. Cocaine, it's a sympathomimetic agent. So and sympathomimetic so means it activates adrenaline receptors. Adrenaline receptors. It binds the adrenaline receptors and it blocks the reuptake of dopamine and adrenergic nerve endings, where it blocks the reuptake of both epinephrine and norepinephrine, while stimulating the presynaptic release of norepinephrine. So it causes it's sympathomimetic. So and and during the usage of cocaine, so heart rate is increased, extremely increased. Blood pressure also kind of increased. And it causes tachycardia, hypertension, and also it causes a peripheral vasoconstriction. And that's why it's in chronic cocaine users, so gradually it comes to hypertrophy of the left ventricle, and along with it, it can cause coronary vasospasm. Coronary vasospasm. So it's because we have receptors of so alpha receptors 2 in coronary arteries, and this causes a contraction, and sometimes it causes effects similar to Prince metal type of angina pectoris. So and especially cocaine use is prohibited for elder people. So because their cardiovascular system is not very is already damaged by atherosclerosis, is already lesioned by atherosclerosis, and that's why and vasospasm here is a cause might cause even infarction in this drug users. Okay, and also chronic stimulation of sympathetic nervous system of heart, it can cause it cause effect known as cardiomyopathy. Cardiomyopathy. It's not certainly known. So what creates a cardiomyopathy? So this chronic activation of sympathetic nervous system, or might be it's due to activation of it's due to derivatives which are present in cocaine. So when you inhale it, so might be some toxic agents are present there, but certainly it's not known, not very well known. Okay. Okay, and also this cocaine also can precipitate little arrhythmias by enhanced sympathetic activity, as well as by disruption normal ion transport. So that's yeah, and usually it happens in patients with already damaged cardiovascular system, and it's just like provocative factor for cardiovascular diseases. So that's why, yeah, pure cocaine, of course, pure cocaine, so which is most, I don't know, most well done, or also which is most expensive, yeah, for in a drugstore, yeah, that's it creates much less effects on cardiovascular system, but even only in younghood, but in adulthood it's very dangerous. It's very dangerous to use. Okay, then but CNS effects. So in central nervous system, it also affects central nervous system, obviously. Yeah, the most common CNS findings are hyperpyrexia. Hyperpyrexia sometimes in overdosage of cocaine. It's called aberration of dopaminergic pathways that control body temperature, and of course it creates hyperpyrexia. And we'll discuss what is a hyperpyrexia changes and how it causes cell injury a little later. And then effects on the fetus. So when if pregnant woman use cocaine, it's of course it can penetrate the blood flow. So it decreases blood flow in placenta, decreased blood flow in placenta, and it causes hypoxia of children, and also and later might cause the spontaneous abortion, spontaneous death of children. So because of lack of nourishment, lack of oxygenation, and then it might cause abortion. But if it doesn't cause abortion, so it causes impairment of neurological development of fetus, and pregnant women who chronic drug users, so it can damage to her children. So this is central nervous system synapse. So you see this is in presynaptic axon. So in dopamine, like in dopamine receptors we have, yeah. When this it releases, it activates the postsynaptic dendrite, yeah, and cause the activation of some parts of our brain, so dopaminergic brain parts. But you know that in the nervous system, you discussed a little bit that we have reuptake of this dopamine back to collect it back to produce more presynaptic axons, so for the next generation of signal. But in case of cocaine use, so this carrier of cocaine back, it carrying of dopamine back is banned, and then of course it causes constant activation of dopaminergic receptors on the postsynaptic membrane, and it causes euphoria in beginning, then it causes paranoia, and in overintake of this it causes hyperthermia. Okay, and then a sympathetic neuron target cell integrant. So same effects we have. Norepinephrine, reuptake of norepinephrine is also banned due to usage of cocaine. And then, of course, it creates the symptoms like hypertension, cardiac arrhythmia, myocardial infarcts, cerebral hemorrhage, and infarcts of the brain. So that's affects. So usually it's usually, once again I repeat it, usually it happens in patients with which cardiovascular system is already compromised. That's why you can see that predominantly cocaine users, they're very young, yeah, and they say, oh, it's not dangerous, it's I don't care about the usage of this, so because I don't have dependence of this. Actually, yes, we don't have cocaine dependence, so physical dependence is not present there, because it doesn't cause the overexpression of receptors, it doesn't cause overexpression of some overexpression of some neurotransmitters, yeah. And that's why if your patient or okay any person so decides to break down this habit, yeah, so then he can recover very fast, but but if we have diseases, if patient has disease, of course it is very dangerous because it's a very high stress for them. But don't forget about chronic effects of cocaine. So as I said before, it might cause a cardiomyopathy. So which cardiomyopathy, it's later cause a cardiac failure, heart failure. So that's why yeah, better not to use it. And but actually you know that in beginnings when cocaine was created, it was used as a drug. Cocaine was used as a anti coughing treatment. Oh no, okay, it's used to like stimulator of brain activity, for example. You know this psychiatrist, the most well-known psychiatrist, whose name is Freud, yeah, Freud or Freud, as you want to pronounce it. So he uses cocaine, and when it's created that it has very hard adverse effects, he just broke down this habit very easily, and then didn't prescribe it. But he prescribed this cocaine to his patients with neurologic changes, so with neurasthenias, uh, to heal this dopaminergic reactions. And actually these mechanisms of reuptake of dopamine and norepinephrine is used in some other drugs, like which are known as anxiolytics. Some antidepressants, they use this mechanism, but it's only a separated mechanism out of aphoria. That's why usually antidepressants, they don't cause aphoria, but they cause the normalization of neurotransmitting inside the brain. Okay. Um, Chronic cocaine use cause perforation of the nasal septum. Yeah, so very typical for the cocaine users, it's a perforation of nasal septum in snorters. So it's not so disastrous. Of course, we can heal it in easy way, so that's not very bad. Not very. It's like hallmark of the cocaine user. So when patient has a cardiomyopathy and he has a nasal septum perforation, so you can claim, oh, he's a cocaine user, and that you need to recommend him to stop using cocaine. And a decrease in lung diffusing capacity in users who inhale the smoke. So it's the same effects as during the smoking of cigarettes. So actually, cocaine is not worse, not better than just using of cigarettes for the lungs. It also might cause later it cause COPD. So if we in chronic cocaine users, as during the inhale the smoke. And of course, once again, I can say is a dilated cardiomyopathy. It's the most dangerous effect of cocaine use. Okay, that is, and in relation to other drugs, cocaine seems like pretty innocent. Yeah, so it's cause euphoria and usually. Unlike alcohol, so it doesn't decrease the activity of cortex or brain, but also increases it a little bit, and that's yeah, it might cause anxiety. It causes so as it's shown here, euphoria, paranoia, hyperthermia, but predominantly it doesn't cause a crime behavior. So yeah, you know that a lot of crimes use this cocaine, but it doesn't create a crime behavior in these patients, and that's why in these people, I mean, and that's why so it's pretty innocent drug, and that's why it's now it's discussable. Yes, so what is more dangerous, use of cocaine or use of alcohol? So it's discussable now, but yeah, but it's ethical problem, not a medical problem. Okay, then but now we'll discuss heroin and other opioids. So you know that in our brain we have opioid-like receptors. We have a lot of opioid-like receptors. So these opioid receptors, they're aligned for endorphins. Endorphins, they're our innate morphines. They're proteins which activate this opioid-like receptors. And in easy words, we can say that opioids they cause so how it's called, it causes activation of this receptor and it relieves the pain. So it's a main painkillers which are used in medicine right now. So opioids are main painkillers. So after the surgery, after the huge surgeries, so we have to use these opioids to prevent the extreme pain, because and during the surgery in anesthesia, sometimes we use these opioids to prevent sudden pain sensation of patient during the surgery. So effects are including the euphoria, hallucinations, somnolence, and sedation. Uh, so it has a wide range of adverse physical effects. So they are categorized as pharmacologic action of the agent, reaction to the cutting agents or contaminants, hypersensitivity reactions to drug, and diseases contracted through the sharing of needles. So first, we care about the first thing, the pharmacologic action of agent. Yeah, pharmacologic action of agent. So we discussed right now. So it's activation of opioid receptors and this relief of pain, and but sometimes over intake of this drug. But chronic use of this morphine so cause the overproduction of this morphine-like receptors. Morphine receptors, mu receptors in the brain. So, and these mu receptors, overexpression of them by the cells, it causes increased needs of this opioids to the brain. and that's why this type of drugs shouldn't be used by people, because even after first second tries of this morphine, so it causes physiological dependence, physiological, not only psychological. You can't treat them just psychologically, because morphine activation of morphine receptor creates so hard euphoria and so good relief for the pain that patients, so these drug users will continue do it again and again, because they can't imagine the life without this drug anymore. So that's why better never try this. So I don't say that you can try other drugs, but I mean, so this is most banned, so should be most banned. But of course we have to use it. So it gives a, you can say, so why we use it in a case of in case of surgeries. Yeah. So why? So do we have junkies after surgeries? Actually, our answer is no, no, because when we use it like painkiller. So it doesn't, and we control the dosage. First of all, we don't give too much dosage to patient, and secondly, it don't gives euphoria. Euphoria happens when we overdose it. So when we give too much dose, and which cause a blockage of all, so not blockage, but activation of all morphine receptors. Then will be euphoria. Then will be this pleasant sensation. But if we give a controlled one, so it just causes a relief of pain. And that's why you know this about drug management, about morphine management of patients, especially with the cancer treatment. So we don't give them so enough drugs for euphoria. We give them drugs just for sensation of just relief, for relief of pain. Okay, and so which okay, but reactions to the cutting agents or contaminants. So it's a very dangerous thing, because morphine is produced by not by pharmacologists. So I mean, morphine is produced by pharmacologists, but heroin is produced by usual people without chemical education, without any medical education. And of course, when they create this, when they produce this heroin, so there are a lot of contaminants inside it, a lot of toxic agents inside it, which so besides this pain relief, it causes a hangover, very huge hangover of this patient. And that we need to prevent, and that's why that's also one of one of more ways we can say that why we should ban this, why we ban this all over the world. And then hypersensitivity reactions to the drug or its adulterants. Hypersensitivity reaction is present in every drug we can use. So, almost every drug we take. So medical for treatment drugs, or might be drugs of abuse. So they can create hypersensitivity reaction. So type 1, it causes allergy. It's known as allergy. So that's why we can say that we can control what's the composition of this heroin, and that's why we can control this type of reactions. And first-time diseases contracted through the sharing of needles. So I was always surprised. Yeah. So just imagine you're as a doctor. So yeah, if you have some heroin, so just imagine you're a heroin abuser. Yeah, you're a drug addicted person of heroin drug addicted. So would you ever share the needle with someone else? I would not. So if I just imagine myself like a junkie, yeah, I never I share the needle, because I know that in the blood we have a lot of potential in bacteria or viruses which can be shared. And but when they use it, they just inject it intravenously and pull a little bit, so to be sure that they're in veins, and then push it down, and it doesn't push all the syringe, and it shares to other person. It's a very strange thing. So nowadays, it's this way of spreading diseases is pretty decreased, because actually once it's heroin abusing, heroin intake is decreased because of well working of departments, departments, police departments against drug politics. Yeah, in drug politics. That's why drug users decreased. And actually, even if they use it, so now everyone is afraid of AIDS. Yeah, everyone is afraid of HIV or hepatitis, and that's why they use, even if they use the drugs, they use it just personal syringe. And now it's syringes are very available, and then they're very cheap, and that's why nowadays these diseases are not spreading by drug abuse usually, but still you can find some examples in your practitioner. So which effects we have? Sudden death. Sudden death, usually related to overdose, is an ever-present risk because the drug purity generally is unknown and may range from 2% to 90%. Yeah, so also because sharing of these drugs is non-controlled by pharmacists. Yeah, so just imagine you are storing the drugs. You are given drugs to your so to your so for your uh, patients, not patients, but clients. Yeah, so they say they came to you and they ask for dosage. And do they check? Do they have some machines which check the quality of this drug? Of course not. Of course not. And when first time some person comes to the drug dealer, so he gives them the purest one, so the purest heroin to make him a drug addicted. But after this, so this drug dealer so gives a diluted one, and then a person cannot control so how much so but might be by mistake when he comes to another drug dealer. So another drug dealer gives a pure heroin, for example, and he used to inject, for example, 2 milliliters. Yeah, so diluted in 2 milliliters. Yeah, but then when he injected, so it appears like it's very pure, and of course it leads to overdosage. That's overdosage, and it causes sudden death. And sudden death usually happens due to depression of brainstem. In the brainstem, we have breath centers, which normally they are controlled by a CO2 level. Yeah, if CO2 level increases, so we make inhale. So if oxygen is increased, so and then we do exhalation, and then if oxygen is enough, we don't inhale it. Yeah, we don't have dyspnea, or we don't have dyspnea in this case. But in drug abuse, during the drug use, so these receptors are very controlled by dopamine, and in dopamine and norepinephrine, and they cause depression of these dopamine receptors, and serotonin also. So okay, a lot of them, so it doesn't matter, so it's not a point. And due to this, some patients, you remember, some of them get sleep. Some of them get sleep, and that's why they start interrupt the breathing. We cannot irritate the messengers that yeah, here we have that you have to inhale. Yeah, but instead of it, so this person so stop breathing, and that's why it became senile. And this patient became so don't inhale air, and of course died because of hypoxia. And another case, so this the same morphine promotes the vomiting sometimes, and in the case of overdosage, it causes vomiting, and then and just imagine, so what happens when person vomits, but can't wake up, vomit and can't wake up. So when he lay down on the back, yeah, so when he vomits and then inhale his own vomit in the respiratory tract, and it causes aspirational pneumonia, and that's why aspirational pneumonia, also causes sudden death. The most common cause of sudden death in morphine abusers. And every morphine, so every heroin abuser, so they know that they after the injection they have to lay on the on the side. They can't lay on the back, so they have to lay on the side, on the left or right side. So, and if vomiting happens, so vomiting should go outside, not in the respiratory tract. And that's and sometimes it happens when suddenly patient turns over on the back, and then in this case, usually they died. So that's why it's very dangerous drug, but it has physiological dependence, and that's why it's very hard to prevent it. Yeah, question.
Sir, in the after surgery, most of the doctor use morphine to relieve pains.
Yes,
Sir, sir, if they use another, can they not use the drugs like diclofenac injections? They can relieve the pain because
because what?
after the operation, some people then chronically use the morphines for their pain relief.
So yeah, unlike yeah, it seems I explained it in beginning. Yeah, I explained in beginning that. Yeah, we thought that possibly this usage of drugs might create usage of morphine like drugs and morphine or fentanyl, so it causes a drug addiction to this patient. But we control the dosage, and actually a rate of patients which after the surgery try to find more morphine and try to inject morphine heroin or something. So it's very reduced, it's very little. So that's why drug abusers they usually first try of heroin happens out of clinic. So that's why never initiation of drug usage, because actually when patient feels pain, so when I said again, yeah, I said again. So morphine like opioids, I mean opioids, they cause a relief of pain only, but it doesn't cause euphoria. That's why psychological effects of this morphine is reduced. Yeah, some physiological changes are there. So some we have little more they produce little more morphine receptors in these patients, but later so they gradually destroyed and by the normal process of autophagy. So this receptors, morphine-like receptors, they are endomorphin receptors. They are reduced, and then patient became absolutely normal. So that's why it's not a problem. And actually, we have no alternative yet. You have no alternative to decrease the pain during the surgery and after the surgery, or after the huge surgeries, I mean. So that's why so we don't have other ideas. So yeah, we have local anesthesia, and nowadays predominantly we use local anesthesia in surgeries. So we try to use. But anyway, in huge, in especially peritoneal surgeries, pleural surgeries, cardiovascular surgeries, so we are unable to make it local anesthesia for them. So that's why we have to use morphine and morphine-like drugs in these cases. So we have no other choice, and actually it's not so dangerous as it seems like. Yeah, I also thought
No,
about
sir.
it. Yes.
Yeah. Sir, at that time it was not dangerous, but after the operations, most of the people I saw in that they used chronically is a habit. Then they use the morphines.
No, 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 no. No, actually, we have protocols by which we can't give morphine for more than 5 days in a row. So about this morphine, so only only in case of cancer. But in case of force, so if doctor gives up, yeah, so when you can control, so we give this treatment. So it's not a treatment, it's just to relieve pain. So they are not going. So Muhammad, you're thinking, Amjad, you think that everyone, so every drug user, so every person after the surgery come to find morphine. It's not so easy to find heroin. So and that's why usually they don't even try to find it, because they don't have psychological dependence. Might be physiologically he has little dependence, but psychologically he doesn't. The patient doesn't. So that's why it's very rarely. It's an extremely rare condition when a patient has approached to heroin and he never used heroin before, but after the surgery he decided to become drug addicted. No, it happens extremely rare. I don't say that it's never happens, but it happens very rare. That's why. So if we compare these things to feel pain or to prevent this drug addiction, of course, we cause the relief of pain. So that why. So and everything depends on person, of course. If person wants to be drug addicted, so he could find this drug addiction before the surgery, usually. Okay, so it's not a problem. And then pulmonary disease. Pulmonary disease. So you remember that injection goes through the vein. Injection goes through the vein and then distributes through the vein into the lungs, and that's why all, some. And in part of injection, they don't always care about antiseptics. So they don't smear it with a spiritus. Yeah, they just inject it directly here, and that's why, along with injection of drug, so they inject a lot of bacteria, and that's why sometimes it causes the vegetations of veins. Bacterial vegetations of vein valves, and then on these vegetations appear thrombi, and then this thrombi might travel through the veins into the heart, yeah, and so as we discussed, thromboembolism, yeah, and it enters into the lung, yeah, so in pulmonary thromboembolism might happen. Actually, this clot is not only just usual clot, but it's infected clot due to vegetation, so due to bacteria settled on them, on this thrombi. So it might create the infection, lung infection, so pneumonia. It might happen after this, and it's very hard to treat it because it's bacteria is in blood, and that's why usually very hard to treat it. So then it causes lung abscess, might be so septic embolism, so it causes opportunistic infection because of decreasing of immunity state. So these drugs also cause the immunodeficiencies. So because of derivatives which are present in heroin, not by heroin itself, but by derivatives which are present, which dissolved there inside. Sometimes drug so drug dealers they dilute the somehow, I don't know why, but they dilute this heroin with the colchicine, which causes depression of immunity, and by itself it causes depression of immunity, and that's why we have opportunistic infections in these cases. Okay, also
Sir,
yes.
sir, air embolism can also be occurred if they
No,
use
no,
itself.
no. So, okay, remember the open the topic of air embolism, and you can check. You can figure out so how many gases should be entered into the vein to cause a air embolism. So it's almost impossible to make it with one syringe. So no, of course not. Okay, and also examination under polarized light often highlights trapped talc crystals, sometimes enclosed with foreign body giant cells. So you see, this granuloma might happen due to talc, because sometimes they dilute this heroin with a talcus, and this talc is it's particles, yeah, and these particles injected in the vein, so of course it can create the vegetations on the surface, thrombi formation, and then chronic inflammation because macrophages cannot digest it, and then we have granulomatous inflammation in this area, and we discussed granulomatous inflammation very well, and you remember this epithelial cells, giant cells are produced, and that's yeah, we already discussed it. Infections, yeah, infections I said, yeah, so due to injection of this syringe, so they don't care about antiseptics, and that's why it causes chronic bacteremia. So it's a constant presence of bacteria in the blood, so due to injections, and especially staphylococcus aureus, it might settle on heart valves, and these heart valves are also forming the thrombi, so it's vegetative thrombi. So that's when thrombi, which is infected by staphylococcus aureus, and then these little clots are spread all over the body, and it causes abscesses all over the body. in patient. And actually, along with the depression of immunity, so they cause sepsis sometimes, and this septic shock happens, and they might die because of septic shock also. And yeah, and also yeah, especially it related to if drug users, so this heroin users, very commonly are infected with HIV. So that's why this contamination of bacteria is very common in them. Then skin lesions. Skin lesions. So because they inject it under the skin, and composition of solution of this drug is not is not controlled by a pharmacology company. Yeah, it might leak a little bit under the skin, and this and it might become mm, um, very injurious, very forming the scars. Not scars, I mean, but it can cause ulceration in the place of injection. Yeah, and also due to bacteria present around, so due to lack of antiseptics again, so it causes a wound which cannot be healed. So when we remember in wound healing, so one of things which prevents a normal wound healing is infection, and here we have infection. Scarring injection sites, hyperpigmentation over commonly used veins, and thrombosed veins are the usual sequelae of repeated intravenous inoculations. So that's why they use different veins sometimes. They don't use only one vein on arm. Yeah. In fresh drug abusers, they use vein on arm. Yeah. So this vein of arm, so which is mostly used in medicine. But after drug abuse, so the scarring in these areas, and actually they're afraid of to show their injection sites of injections. They try to find other places for injections so they might present in pubic region, in leg they inject it. So even in some other parts of the body. So usually in leg, usually vein of legs they use. And that increase the risk of thromboembolism, pulmonary embolism, because large veins are affected, and vena cava inferior is affected, and which is large vein, and it has more opportunities to create the huge thrombi, which can collapse, so which can obstruct the pulmonary artery and cause a sudden death. Yeah, and also renal problems. So renal problems happen due to the same reason, bacteria. So then bacteria might settle in the kidneys. It causes pyelonephritis, so chronic pyelonephritis, and also might cause glomerulosclerosis. And so due to um, and it's caused due to amyloidosis. So patients who use drugs, if you remember in practical classes, some of you explained about amyloidosis. It's a light chain disease. Yeah, when light chains of antibodies are produced, but impaired immunity state cause overproduction of light chains without production of heavy chains of antibodies, and that leads to blockage of kidneys with amyloidosis. So in easy words, I can say. So due to immunity activation, and also infections, they can cause glomerulonephritis in kidneys because bacteria and thrombi disseminated with bacteria. So they penetrate in the glomerulus and stuck there and cause the inflammation in the kidneys. That's why so it's the worst drug to use actually from all the drugs we discussed before. So that's why opioids are used must be banned. Must be banned. Okay. And so and last drug we have to discuss is marijuana. And actually, so what can we say? Marijuana is a main component of marijuana. So why we use it? So it's a tetrahydrocannabinol. Why people use it? Yeah, so it's also due to so it also happen. It also leads. We have cannabinoid receptors in the brain. These cannabinoid receptors they cause same effects as cocaine. Yeah, Also, it will be euphoria, paranoia. So hyperthermia is uncommon, but euphoria, paranoia is very common effects of the drug, of the marijuana use. But also one of other effects, it's activation of appetite, starvation. Yeah. So and then a patient who uses marijuana, so if you ever use it in mass culture, it's also present. So because in some countries marijuana is not banned, yeah, and you can see that after the marijuana use, they used to eat something. Yeah, they eat a lot of snacks, especially snacks. They try to fill their stomach because in CNS this THC, tetrahydrocannabinol, so it causes the activation of centers of eating, so centers of starvation. Okay, so which bad effects we have from marijuana? Yeah, it leads to disintegration, so chronic use or very abusive chronic use of cannabinoid. So it causes disintegration of brain receptors, disintegration of connections of synapses to dendrites, and that's why intellectual activity of this of chronic cannabinol users is decreased a little bit. Yeah, so it's decreased, but this effect is not so hard. Yeah, so it happens predominantly not because of direct activity of marijuana, but actually it's usually created due to how to say it right. Patient doesn't care, so just people who use tetrahydrocannabinol, so chronic users, they don't care about a lot of things. They don't read books. They don't so they don't improve their self-esteem. Yeah, they don't try to reach some positions. Yeah, so they don't need to evolve themselves. They found their happiness, yeah, and they use marijuana, and that's why usually marijuana users are less intelligent, less successful in life. But anyway, it doesn't create so huge troubles with the health as we understand it. So so one of the worst effect of tetrahydrocannabinol is a lungs affection. So and lungs affection is similar or even less than in cigarette smoke. So that's I mean if we don't talk about brain effects, it's your choice, yeah, to use marijuana or not, and your brain decision to use it or not. But in lungs effects, in lungs we have it might cause pharyngitis, bronchitis, cough, hoarseness, and asthma-like symptoms. But it's mild and not it doesn't cause very hard effects, and even COPD present only in marijuana users which along with it smoke cigarettes. Yeah, and might be COPD, chronic obstructive pulmonary disease, is mostly related to cigarette smoking, which happens along with marijuana smoking. But marijuana itself doesn't cause it. So that's why, because of these reports, because of this yeah, because of this investigation, so that in a lot of countries they decided that usage of marijuana is much better than usage of alcohol. Yeah, both of them is bad. Both of them is not a good thing for social life. But anyway, so if we compare them, so it's better to ban alcohol and give approach for marijuana. And actually yeah, so to legalize marijuana. So now you know that the legalized movement is very abundant in a lot of countries. Even in our country, you know that our country is a country where criminally produces cannabinoids and produce the different if I'm not mistaken, in India it's named as hanja, yeah, ganja. Yeah, so this ganja is the most concentrated THC is present there. So it's abundantly produced in our country, and criminally it's shared to other countries like Kazakhstan, Russia. It's I mean that's point of our criminal economy of
Sir,
Kazakhstan.
sir,
Yes.
sir, marijuana is mostly export from Pakistan to other countries.
Yes. Marijuana. Yeah, I also heard about that. That Indian gang rivers. So and the alley of Indian gang rivers, it very susceptible for marijuana. So but in Kyrgyzstan, it's produced by us ourselves. It's not imported in our country, as I know. But in other countries, yes. So we have a lot of drug traffic to other countries from Pakistan, from especially from Afghanistan. Yeah. So
Yes.
also from India, as I know. So
Yeah.
I was surprised actually. I was surprised one time when one of students of Asian Medical Institute so just shown me this some no, so he shown some I forgot what's the name of this, but he said so, oh, this is what we use
Sir,
instead of cigarettes, yeah. And I said,
sir,
Church,
what's the
yeah,
component, how it's called?
church.
church.
Yeah, something like this. And he brought bring it into Kyrgyzstan. Of course,
Yes.
I was very how it's called, pissed off. Yeah, so you're just making drug traffic from India to Kyrgyzstan. So what are you doing? So don't bring it again. Yeah, and actually it was noticement for them. So don't use it. So move it out because our policemen they know about it, and if they will find you with this drug, so of course you'll get imprisoned. You'll get imprisoned, of course, and that's why. So if you have this, you brought it, so you brought it in our country. So please spoil it. So don't use it.
Sir,
Yes.
Sir, it's
sir,
mean, sir,
sir,
it's mean Marjana are not present in Kyrgyzstan.
Marijuana is
present,
present
but
in Kyrgyzstan. It's present. It's present. It's a lot of present, but it's grown up here in Kyrgyzstan, and it's actually you can mention it's this marijuana can grow in even in on streets. So you can check it out. So it's can grow. So it's like uh, grass, so like waste grass, or how it's called. Yeah, so grass which grows without even without planting of them. So all over the Kyrgyzstan. But yeah,
and sir, there,
of course, concentration of
yes,
tetrahydrocannabinol is very little there. And actually now movement of legalization of this marijuana is very hard in Kyrgyzstan because everyone understands that everyone can get it. Everyone it's very easy to take it because it grows even, yeah, it might be in your garden, yeah. And that's why so why we should ban it, so if everyone has approach to this, and actually it's less dangerous as an alcohol, because
yes,
crimes along this during the marijuana usage is much less than crimes which happen due to alcohol abuse.
yes. And sir, they are specially derived from female plants, not male plants. Female
I don't know. It's so
cannabis.
deep, Amjad. So when it will be legalization, you can use your might be if legalization will happen, so you can use your knowledge here in Kyrgyzstan. Okay. Uh, so
Yes, sir.
female males. I don't know that we. Never heard about that we have female or males plants. Okay. Okay, thank you. So now, okay, we discussed only drug abuse. So next time we'll discuss physical agents, and we'll discuss what is a physical agent injury, and also we'll discuss the starvation and diseases which are caused by malnutrition and what is malnutrition. Okay, thank you. See you next time. Goodbye.